So here's gross anatomy, just an example. Our faculty, and actually a colleague of mine from Northeastern, said, hey, you know what? We're teaching gross anatomy at the same time as we're teaching palpation, range of motion, MMT. Could we try to build some type of link in there? So we said, oh, that's a brilliant idea. Why don't we have the anatomy going through the shoulder at the same time, but in the PhysioU app, we could have palpation of all the common structures that they're going to use for their landmarks, for soft tissue mobilization. Why don't we build those two and use those two side by side? So I believe in Northeastern, that's what they're doing, as well as us. We are trying to link what they're learning in anatomy and have a nice resource that they can go to. So this is actually in the PhysioU range of motion MMT app. So if I were to go back here, you'll see here's pec minor in the anatomy lab, and then here is a video.
Pectoralis minor, I'm going to have the patient in a supine position. I'm going to go ahead and elevate the shoulder to approximately 90 degrees, support at the elbow. I'm going to come in and palpate the coracoid process.
So what you can see here at the bottom of the screen, it's a little bit small. We purposely put in origin, insertion, innervation as a link to anatomy, as a way to build that, to kind of build that content and make it even more relevant over time. So the students would kind of see this and go, oh yeah, that's what I learned in anatomy, and that's how I palpate it. And I'm going to reference this again when I get into ortho, when we start talking about scapular faults. So the range of motion MMT app has this type of content. Here's gross anatomy and linking it to orthopedics. So we thought, man, what a great opportunity that when they're in the knee region of gross anatomy, that we would be able to link them to some stuff in the orthopedic app to keep their interest, right? Because now they're learning anatomy not for the sake of learning anatomy. We want to link it to common patients that they're going to see. So we have, this is available on the website. You could always just put a link in your syllabus so students could go watch it. And what this is, for example, this says, hey guys, we know you're in knee pain. You're in the knee joint. Are you curious about the types of knee patients you're going to see in the clinic? So as you click on some of these videos, you can see, well, all of this content is tied to the clinical practice guidelines. So we start the guideline conversation quite early. And what I want you to do is this week, just for fun, it's not graded, I want you to click in and watch how some of these patients present. So this is a patient with knee stiffness, knee osteoarthritis. And they'll go, oh, I've seen that before. Yeah, my grandma has that, or my grandpa has that. So imagine how gross anatomy comes to life, because now they're beginning to associate to, oh, patellofemoral pain, IT band syndrome, meniscal injuries. These are all 1-minute videos, but I think it gives extra relevance to the gross anatomy that they're learning. Let me take a moment. And here as well, we do this by automating an email that goes out to the students Monday, Wednesday, and Friday. So on Monday, they get the email that says, hey, are you guys curious about the types of patients you're going to see for the knee? And so they just watch it and enjoy it. Secretly, I'm giving them graded exposure into the types of content that's in the orthopedic app. And then the next day, we have on Wednesday and Friday, we've chosen a couple of conditions that will actually invite the student in to learn a little bit more about a structure or a pathology that they're learning. So here's your ACL injury. You guys have just looked at your ACL. By the way, here's some tests that you're gonna learn later in ortho. And so they can go in, they'll go, oh, I've heard of that before. Awesome. Oh, I can watch the video. So when I click into the video, what you end up doing is it takes them into the app and they can see, oh, this is part of an ACL assessment. Oh, anterior drawer, pivot shift, cool. So they can explore if they want. But all I'm doing is trying to either connect to their past knowledge or trickle a little bit of relevant knowledge to keep their interest up. Okay, so that is how we do it with these resources. And I'll show you, actually, let me show you right now where those resources are. So if you go to PhysioU.com, you'll see under knowledge that we have anatomy series. And in the anatomy series, we have all the key regions. So if you're like, okay, let's do shoulder pain, you have Monday's video, which is let's learn about these common shoulder pain patients, from anatomy to discovering the patient. So here's a frozen shoulder patient. You could watch what they look like. Here's an instability patient. You could watch what they look like. Here's a shoulder impingement patient. And then from here, you could say, all right, on Wednesday and Friday, I want you to explore a little bit more about a frozen shoulder patient or an instability patient. So you can pick and choose what you want to use. So these are all just little blog posts. And so there's a little bit of prevalence data, some anatomy. What are some of the things you would do for your examination? What you would do with your treatment and therapeutic exercises? Students can just explore a little. Okay, so I think that makes it fun for the students. We surveyed the 3 years. We kind of just fired this out for everybody. And every class, first year, second year, and third year, had something kind of different to say. But all of them said, oh, that's beneficial. That was a great review. I got this in the clinic, and I happened to see that type of patient. It was a great review. Or the first years would say, oh, this makes anatomy so much more interesting because it's not isolated to just looking at the structures. There's a link that's beginning to be built.